At that point, we believe the federal government will be acting illegally, outside the scope of its constitutional authority. The federal health care reform bill will regulate 1/6 of our economy on both the supply and the demand side. It is an encroachment upon the powers reserved to the state of Minnesota and its residents under the 10th Amendment of the U.S. Constitution. Within that bill, there is an unconstitutional individual mandate forcing Minnesotans to buy insurance. There's also a violation of the per-person tax clause or the capitation tax clause in the Constitution with the shared responsibility penalty. The alternative for Congress was not nothing. They could have adopted a constitutional plan instead of the unconstitutional scheme. They could have raised income taxes. They could have imposed or provided a tax credit for folks. But what they've adopted is an unconstitutional scheme that will be struck down in our courts. The battle will move to our courts. So, this morning I hand-delivered a letter to our state's Attorney General, signed by 68 state legislators from Moorhead to Mankato, all calling on our Attorney General, Swanson, to file a lawsuit immediately to protect the interests of all Minnesotans and the state of Minnesota. This is an assault on our Constitution. Our Attorney General needs to step up and act immediately. In 16 minutes, or by the end of the day today, Attorney General Jen Cuccinelli of Commonwealth of Virginia will file a lawsuit in the Rocket Docket, the Eastern District of Virginia. 12 attorneys general from states across the country will either file their own suit or join one of these other federal lawsuits. That includes our neighbors of North and South Dakota and Nebraska. The governor's letter of yesterday to our Attorney General, and ours as well, makes clear the interests of the state of Minnesota are directly affected by the legislation, financially, in terms of its policy, and also in terms of the Constitution. Minnesota Statute's 8.01 mandate that our Attorney General appear in court where our interests are directly affected. And as I've said, we have laid out the case for her that they are now directly affected. Minnesotans insist that our Attorney General lay aside her political agenda, which clearly has gotten in the way of her work. She is our attorney, we are her client. She has essentially been on our retainer for the past 3.5 years. She may not agree with our goals, but we raise meritorious claims. We clearly have laid them out, and now she has a responsibility to act. In her letter of yesterday, responding to the governor, she says that she has not had time to review the 2,400 pages. First, there's 2,700 pages, but we find that oddly ironic, her response. Nonetheless, the U.S. Senate passed the provisions that we're talking about, the illegal provisions, on December 24. The Association of Attorneys General has provided resources available to her since that date. We have provided sufficient legal resources, a wide range of resources in her office available to monitor our state's interests. Our Attorney General should be ready now. We call on her to act immediately, to state her position so we can then act accordingly. I did invite her to this press conference this morning.
I'd only add, since we'll let Senator Ortman or anyone else address the legal issues, I'd only add that the time has arrived. This legislation that is about to be signed in Washington, frankly, is a violation of everything that America is about. It's one thing to talk about compassion when you talk about 32 million uninsured in this country, but we don't even know how many of those folks have access to programs that they choose not to access. And what we're really talking about is the rest of the 300 million Americans that are going to have their choice now determined by government. Their freedom to choose their own doctor, their freedom to choose their own course of care is now going to be affected by their government that's supposed to be based on a constitution that provides for the freedom of the individual. This is not over. This is just beginning. The people will remember in November, and we're confident that in the meantime, there are so many problems with this law that's being force-fed to the states that start with all the shifts with Medicaid, with the allegations of, there are so many different issues with the legislation that have yet to be ironed out, we're confident that long before they destroy the greatest healthcare system in the world, people will speak. So thank you for being here. I think more importantly, what you see behind you and what you see with what Senator Ortman has done and several of these people that are with us is you see probably the most unified group of people that you have seen here in a long time. And it's not just in Minnesota, it's all across this country. I'm disappointed that we don't have some of our colleagues from on the other side of the aisle joining us today, because I know that there are some that are having similar feelings. But again, it's the beginning, it's not the end. I think people will stand up for their freedom, and we'll see a change next November.
Senator Ortman, is this particular, it seems that obviously a lot of focus right now is on the issue of the constitutionality of this particular provision in the bill. Are there other elements of this bill that you see foreseeable in the future that are going to be challenged, or right now this is it?
I think there will be many challenges. This is the start. The lawsuit to be filed in the Commonwealth of Virginia, the Eastern District, will have additional claims because in Virginia they acted early to say legislatively, the governor has signed a bill that says that they will not allow the federal government to step in and manage this issue or regulate this issue. So they have additional claims in Virginia. There may be others in other states as well. There certainly are some policy impacts that we're working on. The implementation may itself raise some constitutional questions.
Senator, is there not, as you talked about both constitutional and financial, strictly from the financial side, are there not financial benefits for Minnesota?
Well, I would ask any one of my colleagues to respond to that. That's not been my focus, although it has been the governor's focus, and you'll see it in his letter. But there may be others here that would like to address that point.
Well, just quickly, what we're hearing this morning is that the transition, because there is talk of transitioning this population to the MA, and the numbers are looking like it may cost the state the next biennium $1 billion+ to do that transition, versus the fixed GAMC, as you saw, would run around 200 and some million. So there's actual costs that we're finding out to the state to make that switch instead of the benefits.
Yesterday, Tom Huntley said this is going to be a $330 million windfall. Brian McClung said, no, it's going to be $14 million. We're hearing a lot of different numbers. What do you believe?
Well, a very good point. So are we. So we're kind of waiting to see that fleshed out. But the numbers that we heard this morning were for that GAMC fix that they're talking about would be about over $1.2 billion in the next biennium.